Thank you very much. I feel like I'm going to draw on a lot of Helen's presentation that she's just done, because a lot of what I'm going to do is about choice and about normalising that birth experience for mums. Obviously, I'm going to talk about it in the context of where a cancer diagnosis intervenes in that pregnancy. And I don't know, for many of you, just as a show of hands, how many of you have ever worked and supported a mum who's been diagnosed with any form of cancer, either pre or postnatally? All right, so there's a few. You'll know, those of you who have been involved with with a mum in this situation, you'll have a fair idea of the contrasts that are involved here. We jump from absolute joy to absolute devastation in the blink of an eye when mum gets that diagnosis, and all the uncertainty that's going to come with that. But I think the more we've gone on in terms of the charity, and as we've started to open up this subject to people and talking about it in opportunities like today, what it's become really apparent is that we overcomplicate a possibly simple situation for some of these mums, and we oversimplify when they should be given loads of choice and the options should be open to them. And I'm going to draw and delve into some of that now. But just for a bit of background, for those of you who haven't heard about us or come across us in practice, Mummy Star, as was touched on, it was set up 5 years ago now. In memory of my wife. She'd been diagnosed with cancer when she was pregnant with our second child, but she sadly passed away 10 weeks after he was born. And what the whole experience highlighted for us as a family is that there was this significant gap in support around cancer intervening during a pregnancy. But also what we drew on is the positive experiences that we had. Her care was exemplary all the way through. From when she was first diagnosed, the choices she was given, how her midwife intervened, the options that we had on a day-to-day basis, right through to the birth itself. We were still given options about what kind of birth we were preferring to have, and to beyond the postnatal care that she had, how little boy was looked after, and the subsequent palliative care that she received. But what it all did was opened up a gap, and that why wasn't there a specific type of support in the UK around cancer and pregnancy, and how do families cope in this situation? So that's how Mummy Star came to be. It was initially just going to be a UK charity. We've since expanded. We cover the whole of the UK and Ireland now, and we're also a member of the International Network for Cancer and Pregnancy Studies, which is based in Belgium. We've just clicked over our 5th year, so we're year 6 now. And just last week, we supported our 500th family to date. So considering the rarity of this, of a cancer diagnosis intervening with a pregnancy, that's a big number for us to have supported in a relatively short space of time. Now, the focus of the charity is threefold. So it's offering support to any woman who's diagnosed with any form of cancer during any stage of pregnancy, and that's whether the pregnancy comes to full term, or even in the situation, sadly, where mum will lose baby naturally, or where there has to be a decision for mum to terminate that birth. Any diagnosis that happens within 12 months of a newborn. And then, as was the situation with myself, if the family loses mum within 12 months of a newborn baby, so that's providing ongoing support to dad and the remaining children in terms of emotional support. So that's, in a nutshell, that's that's sort of the scope of the charity. But the overall aim is about normalisation. It's about ensuring that pregnancy experience for mums is as protected as is reasonably possible. Tracy touched on it, and I wrote it down on my notes. It's about not putting women in a box. So what we don't want is mum comes through, she sees the midwife, she sees her oncologist and the obstetrician, and they just go, cancer. That mum's got cancer, she needs to be dealt with in that way. And we're all about drawing mum back out of that and saying, no, hang on, she came in here as a pregnant mum, and she's going to remain as a pregnant mum, and they'll deal with the cancer over there in oncology, and there needs to be conversations, and the MDT need to have those full discussions with each other to make sure that everything is going to be safe and straightforward as it can be. But ultimately, we want to make sure that she enjoys her pregnancy, that she gets to treasure it, because she's potentially had that experience pulled away from her the minute that diagnosis kicked in. So what we offer, one of the things that's key for all of the mums that we support, because the feeling of isolation that comes the minute they get that diagnosis, is that because it's rare, they must be the only one. They must be the only mum that's, that's been diagnosed with cancer, that's going to go through chemotherapy, that's going to have surgery. And the truth is, as sad as it is, she isn't the only one. There are a select group of women out there that she can connect with. So one of the platforms that we offer is to be able to connect mums with mums, whether it's through, and they connect with each other in different ways on an online support forum that we have, be it the type of cancer that they've been diagnosed with is common with another mum, be it the fact that they've been diagnosed in pregnancy, postnatally, it could be the age, it could be the geography, of where they are, but they all just interconnect, and it kind of self-manages, and it's not restricted on the nature of the diagnosis they have. So sadly, some of our mums do end up with, metastases, so they know that their situation is going to be a life-limiting one. Other mums, thankfully, it remains a primary scenario, but we don't restrict that flow, in terms of pigeonholing mums then again into different types and different stages. It's just an open platform for them to seek that support from each other, in the middle of the night. Like the advice myself and my partner have just been given about, breastfeeding support forums, where it's there for you in the middle of the night, in the middle of the afternoon, in the middle of the day. This forum's the same. It's there, when those mums are, sort of up in the middle of the night because their medication's keeping them wide awake, and they're at their wits' end, wondering how they're going to cope with, with baby over the next few days, or how they're going to manage when they're in hospital for treatment in 6 months' time. It's there, it's offering that conversation for them. We offer a lot of advice and guidance. Obviously, we're not medically based, as it was touched on. I'm not a nurse, a midwife, an oncologist. I'm not a medical background at all. But what we have got, and we can draw on when you have 500 different families coming through, for support, is there's a lot of anecdotal evidence, that we draw on of the different experiences that our mums, go through. So we're able to, share that out with, with the new mums as they come through to us on a day-to-day basis. And a lot of that is about what worked for somebody, the advice around family support, the advice around the hospital. It's playing an advocacy role with many hospitals and midwives. Just to be able to, I guess, step in and, be mum's extra person if she needs somebody. Because a lot of the time when somebody gets handed a cancer diagnosis in any context, in or out of pregnancy, you get given this, this raft of information of all the different support that's out there for you, and it is so much information in what's already going on. It's just too much to take in. And what we found as we've developed is by almost adding ourselves in as an extra support or an extra arm for that mum, we're able to sort of, sift through, what is going to be helpful and what will be helpful for mum, so that she's able to just, click on and go, right, I can go and do this, that can get help from that person, I can get help from that organisation. So we almost act in a facilitation role, if you like. We offer some financial support to families as well, so trying to meet some of the unseen costs, of cancer, which are many. But in the situation that we support through, obviously we have existing children, we have the pregnancy, there could be additional childcare costs. There's the restrictions that some mums have after after surgery. So there's a whole. I won't delve into it. You can have a look on our website if you want to have an idea of what we pay for. But it's wide ranging in terms of how we can offer the support to families. We have an ongoing push on awareness, and I've used the word myth busting there because that is exactly what it is. There are so many theories around cancer and pregnancy that are just simply untrue. You can't have chemo when you're pregnant. You can. My wife did, and she was doing fine. And loads of our mums have treatment while they're pregnant. You can have surgery while you're pregnant, depending on what stage you're at. Treatment goes through to the baby. It'll affect the baby. No, it won't if it's after a certain trimester. So there's an awful lot of work we do around trying to clarify the information that is out there, and trying to remove some of the myths, but also trying to raise an additional level of awareness, not just on how you should check yourself regularly, but how certain cancers can be hidden potentially by an advancing pregnancy, how the body changes, where some of those cancers could normally be detected that might otherwise just be seen as part of pregnancy, breast changes, women that have light vaginal bleeds during pregnancy, they're not, most of the time they're not, but what we're trying to encourage is just always check, always be prepared to consider that could be something else that needs investigating. I touched on it on the opening slide as well, that there is this ongoing support in terms of bereavement for the surviving partner if mum does, sadly pass away. That's something that I've sort of been connected to as a dad, ongoing with my children. After I lost Maya, and that was about sort of connecting dads, again, nationwide, closed forums, but being able to sort of share that experience of in a male-only context was quite important with that as well, because there was an awful lot of, I think, societal presumptions around men and how they will cope and will they deal with things in bereavement. It's part of a much bigger conversation about, men's, fathers' mental health, but it's something we do, and in the past we've helped organise like a week, I want to say a retreat, but it wasn't really, it was a weekend away for dads with their kids basically, but the common factor was they'd all suffered bereavement, but for many of those children it was the first time they'd ever met another child who'd actually lost mum, so they suddenly, for that child, that isolation started to get lifted all of a sudden. How do we do it is, we don't do it on our own. That's the key message. It's with you guys on a day-to-day basis. Every week we speak to midwives, we speak to obstetricians sometimes, we speak to health visitors. We're there to support you, help support mum as an addition, as an additional arm, if you like. We're not experts in it. We're not, like I said, midwives. We don't know, the ins and outs of midwifery. We are learning all along. But what we can do is offer you something additional to be able to support that mum. And it's really, in terms of some of the examples that I can give, it's really good that Tracy's here, because I'm going to name a few examples from her hospital, especially when we saw one of our trustees and one of our ambassadors on her slide as well earlier on. But, like I said, cancer in pregnancy is rare, but it does happen, and it's going to increasingly happen, I think, because of a raised awareness, probably because of women, when women are leaving it slightly later in life to start to have children, they're also going to naturally fall into the brackets of some higher risk, cancers as well. So you will see a raise over time. But also, I think when earlier diagnosis takes place, I think we sometimes get a little bit, I think when we see diagnosis rates, sort of being, going higher. But in a way, that's a good thing, because it means people are getting their symptoms picked up earlier, which hopefully, means that intervention, takes place successfully. But going back to, working with mums and midwifery teams, when I draw on the example that, that we had a midwife sit us down, straight away and say, right, what did you want for your birth? What do you want to do? And in an instant, it was like, cancer isn't the ruler here. It's pregnancy. We're going to have our baby, and that's what today is about. And it was, you can still have a home birth if you like. I was like, oh, wow, we can do what we wanted. We didn't end up, in the end, we ended up getting induced, but that was a treatment-based decision. So clinical reasoning was put in front of us, very, very clear, very understandable, and we knew why the decisions were being made. Not, you are going to be induced, because that's what we think is best in a closed room, and then us just being told. There were open discussions all the time. Share the information. Helen drew on it earlier on. It's about the way communication takes place. It's about the nature of it. It's about, sharing mum's options with her rather than making the decision for her and then coming back and saying, us clinicians think you need this. It's like, well, no, she's mum. She needs to be aware of what they are. One of the key things in this, and it was mentioned in I think you used the phrase communication that causes anxiety. One of the things that we come across with mums quite a lot is when the subject of termination or the potential for termination comes up. It sadly can and does happen, because if some of our mums are diagnosed with particularly aggressive cancers very, very early trimester, then there are cases, sadly, where there is going to need to be a medical intervention of such strength in terms of medication that it isn't going to be viable for that pregnancy. But ultimately, that choice is down to mum. If she wants to proceed, then we need to be able to support and empower her to do that. I touch on the forum in this respect, because we've had many women faced with that decision, and they've gone onto the forum and then said, did any of you other mums ever get told that you needed to terminate so that you could have your treatment? And then, a number of different women have come out and said, well, yeah, they were, but oh no, over my dead body, was I going to, lose this baby because of this? And they've chosen to go on, and they've proceeded with that pregnancy, and they've given birth to perfectly healthy babies. There are situations where mum has done that, and sadly, as her cancer has progressed through the pregnancy, it has become more aggressive, and she has then become secondary. But those mums, if you ask them, they wouldn't change the decisions that they made. They would still have proceeded with those pregnancies. The concern we have is when the conversation takes place, and when you're giving a woman a list of options, and the first option you give her is the one that's going to cause her the most trauma, which is, do you want to keep your baby or not? And what we're trying to encourage is a more thoughtful use of wording around that, so that almost becomes the final option that she's given, so that when the thing that she has in her mind first is, so I can have treatment and I can proceed with my pregnancy, and I can have, this choice, and I could have, I don't know, donor breast milk because I can't, breastfeed after, rather than, sort of giving her something that's going to shut her down straight away. And it does happen. We've had the conversations with women, but equally we've had them come back because we've given them that sort of information and almost empowered them. Even, I think 2 months ago, we had a mum, come back to us and said, if it wasn't for you ladies on the forum, I wouldn't be holding my baby boy now. And the feeling that gives us, as a small team, but also as those mums on that forum of like, they've helped deliver that baby essentially, because, they've given give mum that choice. One of the other things is around just the little extras that can happen, I think, during the pregnancy journey. So, if mum's coming in and out of hospital, it's if teams are open to, to ideas, like we get midwives ringing us up, from time to time, or the midwife will be the referrer to us and we'll ring them up and have a chat, and, we want to develop that relationship. But it's great when we can develop it with other members of the team that are going to care for us. So like the obstetrician at Warrington that I spoke to a few months ago, we had a mum come in, she'd been diagnosed with breast cancer, and I just rang the obstetrician by chance and I just said, look, is there any chance she can just have extra heartbeat monitoring when she comes in for chemo? And the obstetrician was like, God, what a brilliant idea. Yeah, that's really easy to do. The difference that makes to mum is huge. It puts her in touch with her baby. It puts her in touch on a day that's otherwise going to be overshadowed by, dreaded chemotherapy. It's going to make me feel sick as a dog. But no, that day becomes about, listening to baby and feeling in touch, and mum and dad having that time again. And yes, the medication is still going to have to take place that day, but there's simple things. I think your example, Freya, talked about, things that didn't cost. We're not talking about things that cost thousands and thousands of pounds. We're talking about little interventions, but can make a huge difference to mum, and most importantly, give mum control back when she's had it pulled away from her. Another key one of these, and I know this is a bit of a lottery, donor breast milk is a big thing for us in terms of our mums and giving choices. I had it for our little boy, and we've managed to support a number of midwives go through the trust and be able to obtain donor breast milk for some of their mums. We know it's a challenge in terms of the funding with with different trusts and with different CCGs, but the message that I think we always put across to midwives is, and to I think generally just the custodians of milk and of the funding within that situation, is try and see the situation as more than just about baby. And I know that sounds really silly, but it's about mum's well-being. If mum wanted to breastfeed desperately, and you tell her that she can't, that is like ripping her heart out. It did. I saw it how it happened to my wife. That was one of the most devastating things she got told, was not being able to breastfeed again, having done it for 12 months previously with our first child. When that midwife suddenly said, oh, have you ever heard about donor breast milk? It was like somebody suddenly handed the whole thing back to us, and it was like, what's donor breast milk? What's this? I wish every case we deal with was that straightforward as it was with us. It sadly isn't. And it always often hinges on, obviously it needs to be prioritised on the NICU, and we're not arguing the toss on that, but we're just saying about see it as mum's well-being and baby, because obviously happier mum is going to be, happier baby in that situation especially. And mum knows that, baby is getting, what she would have otherwise been able to give as well. I touched on treatment options. There are many treatment options. It is a complex area that you really do need, the obviously case-by-case basis and the oncologist to delve into. But the key things to take away from this are there are treatment options. Chemotherapy is, readily, given to mums diagnosed with cancer once they're well into the second trimester. 9 times out of 10, if a mum is diagnosed in the 3rd trimester, what they tend to do is induce early, so that they can begin treatment or certainly, do surgery for mum straight away. 1st trimester is where we get into that more complex area of how aggressive is the cancer, what is the likelihood of growth if mum doesn't begin treatment within the next few weeks. But like I said, there are options for mum, and that's what we want to be taken away, rather than this shutdown of, oh, you can't have treatment if you're pregnant. This was touched on by the question that was asked at the end just about partners. I really encourage you to think about dads as well, because it's becoming a really, really hot topic. We're doing some work with it later this year around Father's International Mental Health Day. Is about the impact on the partner. Is the partner coping, given everything that they're seeing their partner go through? I'll give you a really good example of this in terms of, fear of birth. I think works both ways. It works for, for mum as well, like the example Freya, that you heard before. I'll give you my example. My fiance and I recently had a baby. Not once during that pregnancy did anybody ask me how I was coping with going through a pregnancy experience again. When we were asked at appointment, so you already have 2 children, and we told them, yeah. It's like, well, they live with you. I was like, am I not capable? But it was the point that it was continuously almost glossed over, as if to say, well, actually, there's a genuine, potential trauma here, having lost somebody the last time you went through, a pregnancy with somebody that you love. I mean, he's fine. He was delivered happy 2 weeks early. Thankfully, he didn't arrive when the snow was in. He arrived 2 weeks. He arrived the weekend between the 2 beasts, so we were able to get into hospital. But yeah, the point is there's many different ways that I've started to come to see, fear of birth and how that works with, with male partners as well, whether it's not a cancer situation, whether it's having you seen your partner go through a traumatic birth, a certain emergency C-section, and how that can leave a scar if it's not dealt with. So please have a think about the dads. I know your time slots with your appointments are really confined, but it's just a quick glance just to say, how are you doing? Are you coping okay? I had a health visitor come round to the house, and this makes me cringe a bit recently, who knew what I did for a living and didn't even say, are you all right? And I find that really bizarre, considering she started the conversation with, oh, so you run Mummy's Star and you lost your wife, and then didn't actually say, how are you coping? We do, in the midst of all of this, we have happy outcomes, okay? Let's not get shy away from that. And even the mums who sadly are in a secondary cancer scenario, like I touched on, they wouldn't change the decisions that they made. And my colleague Tracy's here, we are really fortunate. We get to share the joy of these mums. We get to see these babies, arrive. We have the privilege of, getting invited into these mums' homes to do home visits. We get to meet the children, the families. If we're repeated visits, we get to see some of those children, sort of getting older visit by visit. And it is a real, privilege for us, to be able to offer that support to them. Long may it continue that, the more and more as word gets out about what we can offer, but more importantly about the subject matter and the fact that it needs to be, discussed a bit more openly. So I'm going to sort of stop rabbiting on there, because I'd leave you in your own time to have a little bit more of a read up on cancer and pregnancy as a subject. You can have a look at more about what we do. They're all our contact details if you do want to get in touch. If you do want to refer anybody, if you do have a mum in your care, it's not a complex system. Just give us a ring. That is our referral process. Give us a call and we'll discuss everything with you. Depending on geographically where you are, if we can, we'll come out and see you. And we'll certainly come out and see mum if it's something that mum is happy to. But we won't add ourselves into the equation unnecessarily if mum's already got, plenty of people. We'll sort of be led, by you guys really. So yeah, we're just sort of here to offer help to you if you need it. So thank you very much for listening.